Hello, my name is Jean Dinwiddie. I'm co-chair of the Commission on Aging's Communications Committee. I'm subbing in for our regular host, Commissioner Katie Smith. Our theme this month is Healthy Aging, and we'll explore some of the healthcare options available in the county. Joining me is Kathleen Williams, Director of Healthy Communities with the Holy Cross Health Network. Welcome, Kathleen.
Thank you. I'm glad to be here today.
Oh, we're so happy you could join us and tell us about the Holy Cross Health Network Continuum of Care.
I'm glad to. Holy Cross Health, as many people know, started and built a hospital in Silver Spring in 1963. And from there, we have grown. See a need, meet a need is one of our founding principles. And we have grown into the Holy Cross Health Network in Maryland, where we have the hospital in Silver Spring, we have Holy Cross Germantown Hospital, and then we have Holy Cross Health Network, which has many community services that happen outside of the hospital walls. We want to keep people out of the hospital, and for that, we do have 3 health partners. We have the Holy Cross Health Partner in Asbury, Holy Cross Health Partner in Kensington, and our Holy Cross Health Partner Progressive Medical Care in Montgomery Village. We also have 4 health centers in Aspen Hill, Silver Spring, Germantown, and Gaithersburg that see people that may have Maryland Physicians Care Medicaid or not insured. And we participate with the Maryland Primary Care Program, which includes integrated behavioral health care management, care transitions, chronic disease, and really try to keep the whole person healthy and out of the hospital, as well as many of our health and wellness programs that are either free or reduced rate throughout the county that include, again, chronic disease management classes, diabetes classes, lung health classes, our Senior Fit program, which is well known and well attended throughout the county, and other exercise, health, and wellness classes that we have. And then in early 2023, we hope to be opening our primary care and health and wellness center in Elizabeth Square, which is part of the new building and construction that's happening in downtown Silver Spring near the Purple Line.
That Elizabeth Square is quite an exciting project. Yeah, it's good to know that you'll be part of that. One of the things that Holy Cross has that really is different than other healthcare systems in the area is, like, if I do have an emergency as an older adult, tell us a little bit about that.
Yes, very exciting. We have the first in the nation seniors emergency department that other senior emergency departments across the nation have built themselves around what we had started. And so that is from triage, if somebody comes in with an emergency, they are determined to be an older adult and maybe in need of our senior emergency department. That department, is sort of smaller, has, kind of lower lighting, and all of the staff are trained in geriatric emergency medicine. So that continues to be in our Holy Cross Silver Spring hospital. And through the care from the time you hit the doors to the time you leave the hospital, we do have care management services that provide assessment and support in discharge planning, depending on what the needs are and requirements. We're also a center of excellence for stroke program. So if somebody does come in, has an emergency, comes in, is found to have a stroke, our neurology department is a center of excellence. And we also are a Kaiser Core hospital. So those in the area who have Kaiser insurance, it is covered through the services at Holy Cross. With our discharge planning, we also have services that help with post-acute care. So the transition from the hospital to home or to a rehab center or to those needs outside of the acute hospital.
That discharge planning can be so important. But I want to just get back to, I didn't realize that the senior ED emergency department was the first in the nation. So really, congratulations. So to have all the staff trained in geriatrics, the lower lighting, emergency departments can be really noisy. So I'm sure that's part of
Yes.
what you're controlling
Yeah.
as well.
Yep. So it's really built to meet all the needs of those that may be older. It's also scary to come to the emergency department for anybody. And so, to be able to now, of course, through COVID, we've had some restrictions and so forth, and it has been frustrating, I think, for families and staff. But hopefully we'll get back to being able to have more of a family presence there in the emergency department, with the older adults to make sure that, the special needs are identified and addressed.
Oh, and that involvement of the family is so very important. So I know I brought you back to the emergency department just because I had to say congratulations. But then you talked about inpatient care as well and discharge planning. So is the family involved in that discharge planning? And caregivers need a lot of support.
Yeah.
And even as as an older adult being discharged, it's a stressful situation, and you may not hear everything that's being said.
Correct.
So it's important.
So family involvement is very, very important. And if we don't call you, please call us. We do have standards for assessments that are done for anybody that's in our hospital. When an assessment is completed, we do want the family input. Obviously, there are some restrictions that are put upon the system, depending on insurance and eligibility criteria of the services that are out of the hospital. But we do want to help and support families and patients as they move from one care setting to another. There's a lot that happens behind the scenes, but we definitely want the family involvement. Some of those services can be, our skilled nursing facilities in the area that we help with transition from the hospital to the skilled nursing facilities. Sometimes the care can happen at home, and then we have home care and hospice.
All right, I was going to ask about that. All right.
Yep. There's Holy Cross Home Care and Hospice as well that provides physical therapy, occupational therapy, speech, nursing services in the home after discharge, sometimes prior to discharge as well. Again, that depends on certain criteria that patients need to meet in order for insurance to pay for it. We also have the Medical Adult Day Center and a Caregiver Resource Center. Medical Adult Day is a service that usually is paid out of pocket, that's seen as long-term care, that helps somebody age in place, and their loved ones are able to continue to work or get respite for the day to go grocery shopping by themselves or coffee with a friend. And their loved one can be in a facility that provides healthy foods, lots of stimulating activity and engagement, and also physical therapy and occupational therapy can be had at the medical adult day centers. And then
where are those centers? Where, I mean, the ones you mentioned, it's like great, we're all around the county.
Yes.
So where are the adult medical daycare?
So Holy Cross Medical Adult Day Center is on Dameron Drive in Silver Spring, and that's the one that we have currently. The county has several medical adult day, not in the county, there are several medical adult day centers, but Holy Cross is in Silver Spring,
which is right near where the hospital is, the one we're used to seeing as we drive past on the Beltway. And all right, and that's where the senior, the first in the nation senior emergency department is located as well, right?
Yes, it is. Yep, and right in Silver Spring.
So Kathleen, if you wanted to sum up the mission of Holy Cross Health, how would you do that?
I think Holy Cross Health is about serving the community in a continuum of care. We want to keep you out of the hospital with our primary care services. If you come to the hospital, we are going to make sure that we can get you safely out of the hospital. And then once you're out of the hospital, we want to keep you out of the hospital with our chronic disease classes, our medical adult day center, and again, our primary care services.
So tell me, to access your services, do I need a referral from my physician, or sort of depends on what the service is? Tell me, I've been seeing my physician for decades now, and I really like him, but it's wonderful to be able to take advantage of some of these specialized services. So tell me how that works.
So yes, it definitely depends on the service that you're seeking, and if you need the referral from your doctor. Our emergency departments, you do not need a referral. If you're having an emergency, please call 911 and come to the emergency room. That became a motto during COVID. No, we want to see you if you're having an emergency. For our medical adult day services, and for home care and hospice, you do need some information from your doctor. I do know that we need to be our own health advocates or advocates for our family members. And so if you have any questions about any of that, yes, call home care and hospice, call the Medical Adult Day Center. Our information is on our website. For all of our health and wellness classes, information on how to join those classes. You do not need a physician referral for our classes. That's on our website, as well as in our magazine that's sent home to thousands of people in the area. Our Medical Adult Day Center, you can give us a call. We can do a tour. Same with our Caregiver Resource Center, which provides free support groups for loved ones caring for their loved ones. And that information and schedule of groups are on our website as well.
Oh, Kathleen, this has been such wonderful information. And I once worked at Holy Cross. I'm so proud that Holy Cross had the first in the nation senior emergency department. I think that is just great. If our viewers wanted to learn more about how to access your services, how would they do that? How do they learn more about Holy Cross Health?
So the number one way would be to visit our website, holycrosshealth.org. And that would be the most beneficial. You'd be able to get all the information there at the on the website.
All right. And for those few who might not have access to the internet, I'm sure there's a telephone number they could call.
Yes. So our main hospital number is 301-754-7000. Our Caregiver Resource Center is 301-754-7152.
Oh, wonderful. Kathleen, thank you so much for joining us today. This has been really informative.
Thank you. Thank you very much for having me.
Oh, our pleasure. Thank you. Up next, we'll talk with Dr. Roseanne Khalil, the Medical Director for the Center for Successful Aging at Montgomery MedStar.
Did you know there are more than 10,000 county government phone numbers? But there's only one number you need to remember for non-emergency calls, 311. MC311 is Montgomery County government's online telephone information system. Need information? Have a problem or complaint? Trying to locate a county government facility? Call 311. The call center is open Monday through Friday, 7 a.m. to 7 p.m. The website is available 24 hours a day, 7 days a week.
Welcome back to 50 Plus in Montgomery County. Welcome, Dr. Khalil. Thank you so much for joining us today. So tell us a little bit about the Center for Successful Aging.
So thank you so much for having me. I'm really pleased to be a part of your program. So our Center for Successful Aging, we actually opened, it's a very new center. We opened last August of 2021. It is a place or a clinic or a center where we provide a comprehensive geriatric assessment for older adults in an outpatient setting as a clinic. And older adults meaning 65-year-old and older. We are currently located at the first floor of MedStar Montgomery Medical Center. And we have a full team. If you want, I can start telling you now about our full team.
I was going to ask, what can a patient expect when on their first visit?
Yes. So every new patient gets evaluated by our team. By our full team. Our first appointment is usually scheduled for 90 minutes, and we always tell our patients to expect a 2 hours visit with us. The evaluation happens usually with our medical assessment in the beginning, triaging the patient, getting vital signs, and then they usually get evaluated by our pharmacy team. So we have clinical pharmacists as part of our team, and they go over an accurate medication list. So we ask usually the patient to bring all their medication bottles with them, not only the list written. We ask them to bring all their over-the-counter drugs or vitamins or supplements or anything that we think it's safe because it's over the counter. And usually our pharmacy team will go over one by one, asking about how often they take it, what's the dose, who prescribed it, and all of it will be entered in the system. Then the patient will get evaluated by our physical therapist. So they get a screening evaluation for their functional ability at home. Do they use any assistive device or not? Any prior history of falling or not? Any prior rehab experience or not? And our physical therapists help us determine, does this patient needs a physical therapy course? And would it need to be on an outpatient or home health, home PT? So this is something our physical therapist will evaluate. Then we have our nurse practitioner, where she goes over all the medical history and she does the assessment. So we go over a cognitive or mental assessment, actually cognitive assessment for memory and different areas in the brain. And then we go over mental assessment, which is geriatric depression scale. This is also something we evaluate. She also evaluates the functional ability and with the ability to do their daily tasks for every patient. So this is all the assessment of the nurse practitioner. Then our social worker will meet with the patient and with their caregiver and go over how their situation at home, what type of social need they might have, and she helps with providing them with resources. And at the end, the geriatrician will go after listening to every single team member assessment. And so usually I go and evaluate the patient, do my full physical exam, and finalize the plan based on what I heard from other team members and based on the priorities for the patient, based on the goals of this patient and their family. What are they trying to achieve? And usually we finalize the plan, the medical plan moving forward. So this is our team, and this is only our first visit.
That is a comprehensive visit. I love the interdisciplinary approach to it. And I particularly love that you talked about the goals of the patient and the caregiver. So often you kind of feel that you're not being listened. You know, it can happen that you're not being listened to. It's like, well, it's the doctor's goals and not necessarily my goals. So the whole team approach. And so you mentioned also there's a social worker and to talk with the caregiver.
Yes.
That is so important.
Yes, actually, we recently started to do two at once. So our nurse practitioner will go to evaluate the patient and get the medical history. And at the end of her part, she starts the cognitive assessment. And this is when our social worker will come introduce herself and get the caregiver and sit with them one-to-one in our consult room. So part of our center is a specific consult room for the social worker with the caregiver, where she sits down with the family to listen to their struggles, to their challenges, to what their needs are. And during this time that the nurse practitioner is finishing her assessment with the patient. And the social worker will also sit down with the patient and listen to what they need. So this is also a very important component because we realize how much the social part actually is crucial as we get older. Our needs at home, do we have it or not? Is our setting safe for us to be at home? So this is how we build actually our team based on the 4 M's that we know it for as we get older, right? So our team was mainly built about what matters for the patient, the medication, memory, and mobility. And this is how we really establish the team. And this is how we try to do it in every yes. Initial visit.
Well, as you know, I'm a pharmacist, so I love hearing that there are pharmacists involved, and that's sort of where it starts. So I have been seeing my my primary care physician for decades now, and I really like him. So how would a patient, but I also love hearing about your service. So would my doctor have to refer me? How does that work?
Yes. So we do serve in this clinic as a primary care if the patient wants to. If they don't have a primary care in the area, we have many patients who moved from out the state. But yes, to your point, we have many patients like you who they have a very good relationship with their primary. They don't want to transfer, and they can come to us as a consult, as a geriatric consult. They can be referred by their primary care, or they can be self-referred. We get many referrals from the primary care and we evaluate, we send them back our note. And the same for even if there is a self-referred and they want us to send our note to the primary, usually I will communicate with the primary and send my note to them. And we serve as a geriatric consultant for that patient in terms of, is it a polypharmacy, for example, a lot of medications, we're not sure what to take, what not. Is it for dementia or some mild cognitive impairment? Is it for recurrent falling? Is it for a tremor? Is it for beginning of Parkinson or depression? So usually we do the full comprehensive evaluation, as I mentioned. We send our recommendation to the primary, and if we think that we want or we need another specialist on board, usually we give our recommendation as well, that we recommend following with a specialist regarding 1, 2, 3.
Yeah, because I love my primary. His specialty is in geriatrics, and he doesn't have access to that whole team the way that you do. So that is really so important. And just a 90-minute to 2-hour visit is also most impressive because, you know, it's often 15 minutes in and out. It's a little bit, the pressures on the physician are a lot.
That's very true.
So
and this is how I'm sorry, but this is how we coordinate the care with the primary. So many times they will send us patients for 1, 2, 3, whatever they think that they need to, and we send them the note and we coordinate the care with them so that we're there to help or to support the primary care caring for that patient.
So they become part of your team as well.
Yes.
That's wonderful. So in addition to this really comprehensive initial visit, then I understand that you also have, I think you're calling it an intensive outpatient unit. Tell us a little bit about that.
So part of our Center for Successful Aging is a section we call High Intensity Outpatient Clinic. We go by high up, where it's also a clinic, but we are able to provide interventions to the patient so that we limit their need to go to an urgent care or to the emergency department. So we are able to provide services like IV fluid if they're dehydrated, IV Lasix if they are overloaded, IV nebulizer, putting a Foley catheter in or removing, doing stat labs, doing x-rays, transfusing blood. And this section is actually built in a way that any patient who is wheelchair dependent, they can also be pulled. So all the doors are very large, very wide, and they have a specific entrance so that we're able to push anyone like this in this situation. The only specific thing about our high up is that we need a referral from the primary care or from a specialist. So it's not self-referred. So we accept patients who are hemodynamically stable. There is no acute change in their functional or mental status, and that their specialist is sending them for a certain thing. So we got many patients for blood transfusion, for example, from their hematologist or from their primary care. We got sometimes from cardiology, people who need IV Lasix, and so that we can avoid sending them to the ER. They come to us to receive IV Lasix. We monitor their blood work, and they come to us as often as they need to. So it's all on an outpatient setting, understanding that our older people, our older adults might not do very well in the ER, especially if they have a baseline of memory problem or dementia. It will actually worsen the whole scenario. So we try to avoid it as much as possible.
And it makes sense that you would need a referral from a physician because of the services that you're providing there. A person wouldn't walk in necessarily and say, you know, give me, I need something for this excess fluid, please give me a diuretic, or, you know, that's not something the patient would say. So that is really an additional service that you offer. That's really nice. And to hear that it's constructed for people that have mobility issues is also really nice. I imagine that your entire center is constructed that way
Yes,
as well,
actually,
right?
yes, to your point, that's very true. Actually, all of that. This is something. When it was built, it was like this: that the doors were very wide. The room is much larger than any typical primary care room, because we understand that the older patients will come with their family members. Many times we have at least one family member on board. We have one or two based on the need. So everything is set up in a way that we can have all of them if we want to discuss, especially at the end, if we want to discuss the goals of care or the plan moving forward. We have a place for everyone. Yes.
All right. I have my initial 1.5 to 2 hour visit.
Mhm.
And then what? What about follow-up?
Mhm.
I suppose so. I'm your patient now. I'm not, through my primary care now. I'm yours. You're my primary care physician.
Mhm.
So then you'll see me for this. The whole team will see me. Do I see the team again? Do I see you? I imagine it depends a lot on what's going on with me.
That's very true. So usually the follow-up frequency is decided based on the clinical stability of every patient. Some patients might be in an acute heart failure, for example. I might see them every week. Some of them, they're very stable and they don't need to be seen more than once a month or once every 3 months. So how often we see them, it's really based on what's their situation, clinical situation, and what are the needs of the family as well. Regarding the follow-up, no, they do not see all the team. Usually on the follow-up, they see mainly the nurse practitioner, and I am available for any urgent issue or any consultation in terms of coming to check on the patient. So I am always available. Usually the follow-up with a nurse practitioner. However, also based on the patient, we might do the follow-up on a day where he will be or she will be evaluated by the social worker or by the physical therapist. So the team members are available for the follow-ups. However, it's not set up that all the team members will go to all the patients for the follow-up. However, if there is any active issue, then yes, they are available.
Yeah.
Our follow-ups usually scheduled for 45 minutes.
All right. Still, that's a nice long visit to give you time. So this is wonderful to hear about, Dr. Khalil. Thank you so much. If one of our viewers would like to come see you, what's the best way to get in touch? What's the best way to learn more, to make an appointment? How do they get in touch?
So they can just call our number to schedule a new appointment. The number is 301-570-7400. And they can say that we're here to schedule a new patient visit. Usually we mail them or we email them an initial packet to fill some information. So filling it before the appointment will be very helpful. It's not mandatory. So we're going to see them no matter what. But if they're able to fill the initial packet where it goes over their medication list or specialists or hospitalizations or functional status at home or social status at home as well. And we see them in the clinic.
Oh, thank you so much, Dr. Khalil. This has been so informative. And I think your Center for Successful Aging in Olney I can't imagine that you won't have a team of older adults coming in through there to see your team. So
yes,
thank you very much.
Thank you for having me. It's been an honor.
Oh, my pleasure. Thank you.
Yep. Take care.
Thank you. Well, that concludes our program on healthy aging and some available options in the county for older adults. We hope that the information provided is useful for you. To learn more about the many services for seniors in Montgomery County, please visit the Montgomery County Seniors website at montgomerycountymd.gov/senior or call the Senior Resource Line at 240-777-3000. And as always, thank you for watching 50 Plus in Montgomery County.
Senior Call Check is Maryland's free service providing an automated daily check-in call for residents 65 and older. Senior Call Check makes an automated call every day, and if there is no response, follows up to ensure that you or your loved one is okay. Call 1-866-50-CHECK or register online at aging.maryland.gov.